Once considered a death sentence, Cleveland Clinic neurosurgeon Dr. Gene Barnett explains that brain tumors today are often very treatable.
It used to be that all brain tumors were almost uniformly fatal, at least the malignant ones. But now we're doing much better with certain types of tumors, and people more or less have a chronic disease as opposed to a fatal condition.
59-year-old William Sanders faced a bleak diagnosis 6 years ago.
That's when I learned that I had a glioblastoma. When I heard what this is and was told that many people only live two months because of how quickly it was growing, I thought, boy, this is a real worry here.
After surgery, Sanders' doctor recommended a clinical trial, a new targeted therapy drug that focuses on the altered genetic changes seen in tumors.
Every time you go to a new medicine, you have to adjust to it. It was initially harsh, but during those 8 weeks of trial, it got easier and easier to take. I decided to do it because standard, practices would lead to standard results, and they weren't good.
It's now been 3 years since Sanders has had any type of chemotherapy. He's in remission. His advice?
Find a good doctor. Go for something that's a little bit different, that he has faith in, and appreciate having the chance to take it. You just have to have faith and belief.
Brain tumor treatment has definitely come a long way.
For the secondary or metastatic tumors, that targeted radiation called radiosurgery is extremely effective in terms of controlling those tumors. We use something called the gamma knife here for that. That essentially kills the tumor or makes it go dormant.
A new treatment being pioneered at the Cleveland Clinic is a laser surgery called Neuroblade.
It's primarily used for tumors that start in the brain and makes many tumors that used to be inoperable have the benefit of surgery. That's by precisely placing a laser probe into the tumor and then bringing an MRI machine into the operating room, where we then monitor the heating of the tissue so that we literally cook the tumor. Usually it's through about a 1/2-inch incision and a 1/4-inch hole in the skull. So it's truly minimally invasive. There's a lot of interest these days in vaccines and certain viruses that can be used to treat brain tumor. A lot of promising studies that we're involved in here as well, but it's too early to tell whether and how effective they're going to be for how many people.
It's getting to a point where people don't have to settle for 2 months or 4 months or 1 year. Hope is there. You have to appreciate the fact that you got a warning about death.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.